And it was my high school track and cross country coach. And the thing that really developed loyalty, and I think of, up until I was married, the biggest influence in my life after my parents was this coach, Dave Robbins. And he did not dismiss basically a goal I had that any rational person would have said, that is not an achievable goal, Dave.
Welcome to the Loyalty by Leadership podcast, where I, Darrell Moon, your host, interview people who have been inspired by leaders, as well as leaders who strive to inspire, where we discuss leadership, insights, and strategies that add value and create loyalty. Welcome to the podcast Loyalty by Leadership. I am so excited to have one of my mentors and people I respect immensely in the industry, Dave Chase. Dave is the CEO of Health Rosetta, which is an organization that is driving a whole new model of healthcare across this country. Dave, welcome, and it's good to have you with us.
Thanks so much for having me. Looking forward to the chat.
So tell us a little bit about your position and your company, just to kind of introduce yourself.
We're a kind of a social movement, social cause, with a business, delivery mechanism, which is, it's like, how do we take this incredibly frustrating thing of healthcare, health plans for companies? Typically it's a second or third biggest cost for them after, payroll, and turn it into a competitive advantage rather than kind of a boat anchor, that is either a boat anchor on their business or their employees or both. And that's something that we've been doing a lot of, and a lot of people have kind of been surprised that it's even possible. But it's a lot of fun. Like, we can deliver huge value today for both the employer and the employees while we're working on a really tough, 20-year problem. So it's kind of striking that balance along the way.
Well, and it's a win-win for not only the employer and the employees, but the providers in many cases too.
Yeah. I mean, it's funny. I was just having breakfast with a woman who runs a PT practice in my community, and she's involved in economic development committee as well. And I shared the fact that, in the country, nationwide, clinicians only get 23 cents of every dollar that we spent ostensibly on healthcare. And most of us think what doctors, nurses, medical assistants, like, this is literally everybody plus a 30% premium for benefits. And then I told her, in our county, because this data at the Bureau of Labor Statistics data is measured at the metropolitan service area level, it's only 15.6 cents of every dollar actually goes to the primary value creators in healthcare. And so, it's guaranteed applause line in any room full of clinicians. I was like, hey, healthcare is not expensive. You're only getting 23 cents. What's expensive is profiteering, price gouging, administrative bloat, fraud, and some inappropriate care. And guess what? Those things are optional if you know what you're doing.
Great. So Dave, thank you for being with me today. Let's jump into this loyalty by leadership topic. Can you share with me some of the leaders that you've experienced in your life and how they created loyalty within you?
Yeah, I mean, boy, you could go so many different dimensions, but I'll just go with what came to mind. First one was kind of a personal and athletic one, and then one a professional and today type of thing. And it was my high school track and cross country coach. And the thing that really developed loyalty, and I think of up until I was married, the biggest influence in my life after my parents was this coach, Dave Robbins. And he did not dismiss basically a goal I had that any rational person would have said, that is not an achievable goal, Dave. But basically, they I switched to running late, like it was my junior year in high school. And somehow they had made running cool. It probably didn't hurt that we were in the shadow of Nike's headquarters. And they had just knocked off the dominant power in the state. And Oregon's got a huge history in running and all that. And this school, in the shadow of Hayward Field, which is the mecca for running in America, they'd won state like 12 times in a row. Our school knocked them off. Everybody was coming back the next year, and I'm like, I want to be on that team. And I was a sprinter. Like, it was really bizarre that I went into middle distance running. That's a whole other story. But I'm like, I want to be on this team. And I was the guy when running was punishment. When you're playing football and baseball, and I wasn't at the front of the pack. But I'm a pretty determined guy, and it's like, okay, here's how we're going to break it down. You're going to need to, by the time we get running, rolling in the season, you're going to put in 500 miles over the season. You're going to work up to 50 to 70 miles a week. And, if you can be in the top 14, on our team on that first race, then you just need to knock off one person a week. And like, okay, I'm going to do it. I later became a coach, and I go back and look at the times that we were all running, even in this day. It was pretty remarkable. I was too stupid to know that like that's not something you're supposed to do in your first year of running is, run sub 16, as a former sprinter. But I was like, okay, I'm on for that ride. And so just that type of thing.
Your coach believed in you and didn't dismiss it.
You, right? And had a way of taking this unrealistic goal and breaking it down like, hey, who am I to say that you couldn't
you want to go for it.
Deal with that? And of course, there's ups and downs that happen along the way. And then I think in the professional context, we just had our big annual event called Rosetta Fest, and I think this is a co-leader in it. Lynn Ann Henderson is really the maestro of this, and it's another instance of establishing really crazy goals that people in their right mind wouldn't establish. And
like taking on the healthcare industry, largest industry in America.
Yeah, right. And then how many, the type of people and the amount of people, and two of us, share, faith and a belief that if you establish goals that you could achieve on your own without God's help, they're too small goals. And so we're in lockstep on that. And so we did that, and we achieved, like, this was, we were in Denver this past, event, and we were there 3 years ago. In Denver 3 years ago, we had 200 folks attend. We were happy. It was a great event. Yeah. We just finished an event with over 1,300 people, and we had pretty equal numbers of clinicians. That was a new thing. We wanted to have a lot of physicians and other clinicians. We wanted to have a bunch of employers. We hadn't had that before. And then we decided these awards that we give out every year for the best employee health plans in America, rather than having the ballroom, we wanted to take over Coors Field, the Major League Baseball stadium, which was another crazy idea. And we pulled it off. And even though it was raining, like, we had plan B for that. And so Lynn is somebody who is really good at, she's gotten this Gallup strengths training, really finding the strengths in other people and how to bring those out, how to make the most of those talents they have. We all have different gifts that we've been given and we've developed. And she's really remarkable at doing that. And then also that kind of, that servant leadership. Nobody works harder than Lynn Ann. And she had a lot of curveballs thrown at her. She's had eye procedures this year and a passing of her father-in-law who, lived with them in their house, and she was a primary caregiver. Despite all that, managed to pull off an incredible event, far exceeding our very aggressive goals. That in hindsight, like, even I was like, that's kind of a crazy goal. And then, you think about having a business conference in this economic environment, what is the first thing that companies do, when there's uncertain economic times? They cut marketing and they cut travel. Guess what a conference is? Travel and marketing. But we managed to exceed our really aggressive goals that were established even before we had the economic chaos. So she's the type of leader that people rally around, and I have deep loyalty for her level of creativity and just out and out work effort. She's not, up there in some tower telling people to do stuff she's not willing to do herself. So I love those types of leaders.
So a trust in God, seeing the best in other people, and a willingness to get your hands dirty and get involved. Those are all leadership strategies that you admire in Lynn-Ann?
Yep.
Did I say that right?
Henderson. She's got kind of, even though she grew up in Montana, it kind of has that Southern girl sort of name, kind of the two names put together.
Right. Anybody else that comes to mind that you've worked with or have had the opportunity to work for that have created loyalty within you?
Yeah. Going back to the faith side of this, we had a leader for this organization called Fellowship of Christian Athletes. It's still around, and our leader Al Egg, he ended up becoming the Portland Trailblazer chaplain, but he was really a wonderful example of leadership, and certainly in the faith dimension of it, but also just he had a real tragedy happen. His daughter was in my class and she died in a car accident. It was a kid doing a pretty irresponsible thing. Most people would have wanted, that kid dead and ruin his life.
Revenge.
It was, again, a really bad scenario, but he was testifying on behalf of that kid why he'd made a mistake, he'd owned up to it. It wasn't going to bring his daughter back to ruin his life. And that kind of leadership in the face of, just an unimaginable, painful situation was remarkable. And again, somebody who, I'm getting goosebumps just thinking about and talking about him, that could really draw out of people their best selves, and he really lived that.
Nice. That's a great story. Thank you.
Yeah.
Are there any leadership styles or approaches that you like to take or that you strive to as you lead a number of people and you lead this movement? What are some of the things you've tried to deploy?
Yeah, for sure. There's a few that come to mind. I would say number one is I think it was a purpose-driven leadership that transcends profit, right? In healthcare, any fool can make money in healthcare. Yeah. It's a bloated, inefficient system. But to do it with purpose and solving a systemic extraction of wealth out of the working and middle class, rather than which is what our system's done, left 100 million Americans in debt to healthcare today, rather than just maximizing every last penny. That is something that no matter how old you are, I think we sort of associate it with younger people want to, go to a work environment where there's purpose and meaning and all of that. But who doesn't want that, right? I think it's a real underestimation of what's possible in leading organizations, that it's only about just show up, punch a clock, go in, go out, and live for the weekend, and maybe have some give back you can do when you're old. That's to me a really low expectation to have of an organization, and I found that that's a great way that most younger workers, you think 70% of the workforce today are millennials and Gen Z, and it continues to grow. They will leave jobs that don't align with their values, and healthcare is one of those areas where you can really transcend just purely, having a healthy bottom line, and tackle really tough problems that are facing our country, whether it's student debt. We have companies that they save so much money in their health benefits that they fully fund college education for their employees and their employees' kids. Like, that's amazing. Yeah. You can imagine what that does.
Talk about creating loyalty.
Yeah, right. Talk about loyalty and And what that does for employee turnover, obviously from just a business leadership perspective, particularly they're in a high turnover industry, and you have too many barriers for mental health. And, we have health plans that were, the status quo health plans, if you really look at them, they're not that different than what was developed 50 years ago when it was the greatest generation or silent generation and boomers who were the main chunk of the workforce. Today, and the main issue was acute medical events, right? Today, like I said, it's over 70% of the workforce, millennials, Gen Z, and it's mental health, it's chronic disease. And there's too many barriers put up in front of those things in the existing system. And frankly, the less expensive parts of the system. And then it's this unlimited corporate credit card for the stuff that's really expensive. It makes no sense. So to me, that's this kind of purpose-centered organizations and leadership that's about more than just praying to this golden calf of profits. Like that. Yeah. That's the only thing that matters.
Well, and I would think in your organization, because it is so purpose-driven, that's a pretty easy thing to communicate with your team. But tell me a little bit about how you like to do that. How do you try to communicate the purpose of Health Rosetta as you bring on new employees or team members?
Yeah, boy, that's a good one. It really, what I have found, and it was a real stretch for me, that I would say really came out of doing this. I did this TED Talk and I took this course called the Story Academy. They train CEOs, speakers, all this. And one of the things that was not in my comfort zone that they got you to do was really, they have this sort of, there's this notion of a system change approach where it's the story of self, us, now. And it's this public narrative on how you shift things. And the point of the story of self is, why does it matter to you? What is your story? I was like, I don't matter. Like, why? It's not about me. It's about this broader thing. Like, no. Like, people are going to listen to you and believe in your integrity and your sort of authenticity if you're actually willing to be somewhat vulnerable. And I'm not the most reflective guy ever. And it really forced this sort of self-reflection. I'm just kind of a taskmaster. Do stuff, get stuff done, and check stuff off the to-do list. Be a helpful guy, and that was sort of my default position. And so one of the things they did was, I hadn't done this much drawing since I was probably 6 years old. I had this big paper, write out the key events that happened each decade of your life, and what were those things that remember that sort of, again, stood out in terms of your unpacking your values. And it was kind of a funny exercise doing this. And I'm a horrible artist, but it did unpack, why am I a maniac about this? Why does this thing matter to me so much? And I was doing public speaking before, during, and after that. And even while I was kind of just trying to get some of this under my belt, I was like, well, I'm going to give it a go. And the difference was palpable. Once I talked about how a system had destroyed a friend's life physically, financially, emotionally, leaving behind a 10-year-old daughter. And when I had unpacked how I'd been raised, was my parents basically said, if you see a wrong and you don't do something about it, you're complicit. I don't know if those are the exact words, but that's how I looked at it.
Yeah.
And I was like, oh my gosh, we have the greatest heist in American history. What's happening here? I got to dig into that. And so I've brought that into my work. Both my team is the people who are on our payroll, but I think of about a broader virtual team.
Right.
And the reaction that I got when I told some of that story was just so different. And people were coming up to me and they had their story. And because healthcare, health plans. It's this intersection of finance, personal finance, and health, things that most people don't talk about with other people. They didn't really know the extent of the pain that so many people were suffering. And so that I've just leaned into more, is being more personally vulnerable and not be so compartmentalized. I mean, earlier in my career, it's like work life, leave work, personal life. Now it's like all kind of more blended in. And I think that something that struck me on this journey and is the, I kind of become career coach for some folks, and I became literally a high school track and cross country coach.
Did you?
Yeah, but also in a career context. And I said, when you become, you get out of school, generally it's better to have a job than not have a job. But you develop some competence and you start to develop a career. And that's definitely better than a job. And you get rewards and it's more fulfilling. But far better than a career is, the old, I think it's a Mark Twain, you find, what are the two most important days of your life? The day you're born, the day you figure out why. When you find your calling, that is so much better than a career. And you become an unstoppable force. And you can deal with just about any adversity thrown at you. There was this metaphor related to that I really like, that there's this story, who knows if it's true or not, but Michelangelo was asked about his famous work, the David. Like, how did you do this? How did you imagine that? And he said, well, got this big chunk of marble, and I just removed the parts that weren't the David. And as I talk to people, it's like inside of you, you all have this David, this amazing individual that can uniquely bring value to the world. And you have all these impediments, your upbringing, economy, society, whatever, just chip away at those. Yeah. And so that type of thing, when you show that belief in people and that help them, to me, that's part of what a great coach does, is they're almost this funhouse mirror of like seeing reflection, something that they don't see in themselves, and helping them remove those impediments so they can become the best version of their self, which isn't what's the best version of you or me or anybody else. And so I find that is very motivating for folks.
Nice. I love the fact that you bring up story. And you were one of the very first people who wrote about the best healthcare system in the world, which is up in Alaska, the NUCA system of care. And I love the fact that story is so important to their ecosystem that every employee, every doctor, every nurse goes through this core concepts training on how to get people to tell their story. And then to build trust in those people, it's how you respond to that story. You don't tell them they're wrong. You don't ask them a bunch of questions. You simply show gratitude. You thank them for telling and being vulnerable enough to share their story. And it puts an underline under this whole idea of, if you want to be a leader, build trust. Whether you're the doctor taking care of someone's health, or whether you're a boss trying to help an employee, build trust. And building that trust can be all about being vulnerable yourself, or getting them to be vulnerable, and then just thanking them for sharing that story.
Yeah, I mean, it's what an amazing. I know you've really done a great job of documenting that story, and I tell people that when something in basically kind of how you measure, in 15, 20 years can go from the worst health outcomes in America, some of the worst in the world, to a system many consider the best in the world.
Amazing. Something
special has happened, and as you know, really a tough setting. Like I'd challenge anybody to find a tougher. I mean, others probably as tough. Find a tougher scenario than what they overcame.
Abuse, really addiction, amazing. Chronic conditions, obesity, everything.
Geographic, right? 65,000 people of the size of Sweden, right? They got people on little islands, right? They were getting, Alaska has a horrible history with pandemics. And, when the vaccine was first available, they, with their legacy in Alaska of losing so many people, that's the story behind Iditarod. They didn't make excuses. That's, to me, the biggest thing. They are not the people in healthcare make excuses. And it's pretty sad. The people who doesn't make excuses, the value creators. And that's a no excuses organization. Did they have to get in some inflatable Zodiac to go out to an island to get somebody the shot that they wanted? Yes. Did they let that be a barrier? No. I mean, they were in float planes. I mean, you name it. They got it out to these people. And that transcends all of what they've been doing with their healthcare system is, no medical people in this place. We need to have medications. Well, they create a bulletproof vending machine for medications.
Dispenses medications. Yeah, it's incredible, the stories. Well, and the fact that they look at every decision with the 8th generation in mind is incredible. Like, we don't do that. And yet if we did, what a leadership strategy that would be. If we think of every decision, how that's going to impact my great-great-great-great-great-great-grandkids.
Yeah.
That's immense. That's huge.
Yeah,
So,
totally.
well, Dave, thank you so much for sharing those ideas. I love those ideas. Tell us about Health Rosetta. Let me give you a chance to really kind of promote this amazing organization that I love. I promote it. I talk about it all the time, but I want you to talk about it.
Yeah, totally. I appreciate you giving me that opportunity. I alluded to this a little bit earlier, where most executives, I think of Health Rosetta as sort of uncovering this hidden profit center that most CEOs ignore. They think of it just as this necessary evil cost center, goes up uncontrollably 5 to 20%. The so-called solution is just to shove more onto the back of the people least able to afford it. Like, that's the solution that the status quo industry has offered up. And so we don't buy that. And so, we think that, you wouldn't accept, anywhere else in your supply chain, manufacturer wouldn't accept a supplier would raise prices 15% annually while delivering worse quality. Nobody should accept that. And so that's basically, I joke that I went from, being Indiana Jones to Johnny Appleseed, where, the archaeologist in me was like, okay, that's how I found the Nuka story. It's like, who's cracked the code? People are problem solvers, no matter where they are in the world. They got a problem. Maybe they don't have all the resources in the world, but they're going to solve that problem. And that's where the Rosetta Stone metaphor came in. Like, these were the people who'd cracked this indecipherable code. And so whether it was the Nuka model or the Rosen folks, we'd pull out what are those common threads that would be applied anywhere. Like, Nuka folks did incredible with primary care. So did Rosen. Right? That's one of those things. And there's other elements too. And so we basically said, okay, we're just going to create this blueprint. And then I go from Indiana Jones to Johnny Appleseed, and spread the word. So the way that we spread the word is we train people on these methods and came up with this way to grade a health plan. And it was one of these things where we're like, there's so many weird things about this healthcare deal. Like, we're in an era where, I hop in a Uber, I can rate them, they can rate me. Like this pen on Amazon, I can get 40,000 reviews for it, but 20% of the economy, there's not an objective market value. And so It took us a while to figure that out. But we basically train people on this thing called a plan grader. We figured out the 40 most important questions.
Elements.
And so even as a CEO, you may not be some health plan wonk, but you know that, oh my gosh, like our plan, we were told this is as good as it gets, and it got a 17 out of 100.
Yeah.
Maybe I should look into this. And if you look at the Rosen folks, They just did what they do in every area of procurement. They work with high value partners. They bring in-house things that the market isn't addressing, and they put it out there. And so we said, okay, here's these tools that we're going to train these people on so they can, to use a medical metaphor, they can diagnose, and get basically a diagnostic score. There's an overall score, and then there's 8 sub-scores that go into this. And then we'll give them the, torch that metaphor, the prescription or care plan on how you address that.
Fix it.
Yeah. You don't need to do it all in one fell swoop. Just if you were a polychronic, obese smoker, right, you probably wouldn't become Ironman vegan triathlete the next day. But you can do that with your health plan. And frankly, these health plans are toxic, cancerous, obese plans that could be amazing competitive advantage driving tools.
Well, and I get in front of a lot of CEOs. I speak for Vistage groups all across the country, and I hear this all the time. I hate this topic. Healthcare is like my biggest frustration. I hate it. I don't like it. I don't know what to do about it. And so you've created this way where an employer can say, measure my plan. Give me feedback. Give me the kind of things I like to see, which is a dashboard. And then I can actually do something to fix it. I was to lunch yesterday with a large manufacturer here in Utah County and just shared with him this whole new way of looking at healthcare. And by the time I was done, he said, you just made an evangelist out of me. That's
the amazing thing.
Tell everybody.
I mean, and it is that evangelical moment, or sometimes I'll call it the road to Damascus moment. It's like suddenly there's this blinding light, right, that hits them, and like, oh my gosh, like I can do something, and then they go, like, one of the locales that we've done this is Ashtabula, Ohio. It's a classic, stereotypical working class community that frankly has been on a losing streak the last 20, 30 years. And the benefit advisor we trained, talk about a leader. He's really become a leader. I mean, he was going to leave the industry. It was miserable delivering about this time of year. Great news, Mr. Employer, you're going to pay more and get less, right? Yeah, Bryce Heinbaugh, amazing leader. And to see the light come back in his eyes and to be a man on fire that is even, really evangelical in his zeal, and a true, missionary for what we're doing, and very open. Like, he's made a big difference in his community, but he's very open about sharing this with other people because he's seen the kind of difference that it has made for him personally, professionally, and then more importantly, the community. People that are being served by the plans. Like, again, we're solving this really tough long-term problem, but the day one of these health plans goes live, it's life-changing for people. These people who were afraid of the healthcare system. About half of Americans avoid the system because it pretty much guarantees financial ruin. They're functionally uninsured. Their life savings are less than their deductible. To have it be like, all of a sudden, I had this $300 a month medication as a teacher, and now I pay $0. That's like getting a $300 a month raise every month. So those types of things, you mentioned, we're talking about Rosen. I mean, their turnover is 6 times better than their competitors.
Nobody wants to leave.
And the loyalty, right? Talk about loyalty. When you go, actually, this owner of the PT practice I mentioned earlier, she actually stayed in their property. I was bringing up, she said, oh my gosh, you could tell those people loved working there. And they had family members working there. And you talk about loyalty. And then, from a business perspective, the fact that he could grow that business 10x without taking on any debt, and they were the only major hotel to stay open during COVID. Of course they got hit, but they had financial resilience that none of the others did. And it helped in every way. And he passed last year. I went to his memorial, and, it's exactly the memorial that anybody would want to have in terms of what people were saying about him, the impact. And I just saw the healthcare part of it. I didn't see, he he had supported the hospitality school. I think his University of Central Florida. He had gone to Cornell, which had been the top when he was in school. Central Florida, best hospitality school. And then he'd done stuff with the swimmers and the YMCA, and there was of course all the stuff with the schools, and he'd done stuff with the Jewish Community Center. Like, his impact was amazing because they've saved to date $570 million benchmarked against other employers. That's the kind of impact you have when you can roll up your sleeves in this area.
And then he invested it in the community. That's the amazing thing.
Yeah, crime goes down 80%. High school graduation in an area was unacceptably low is 100% some years. And it's very high because he's not only paid for college education for his employees and their kids, but also these communities. And I just was with the CEOs taking over his longtime business partner. They just are adopting a third neighborhood. The second one was 5 times as big as the first one. I don't know exact the size. That's the type of thing, and it's just a portion of the savings that they've driven. They're able to do that.
And I think that is such an amazing story, to be able to tell a CEO that they can take the spend they're already making and change that to improve loyalty and improve the lives of their employees and the community. Not spend more, spend less, and invest that in something better that's going to create more loyalty.
And it sounds too good to be true. That's why we publish case studies. Like, don't believe us. Yeah. Go talk to Pfeiffer, a manufacturer in Alabama that's basically following their model. They're giving out scholarships, summer enrichment programs, and going above and beyond. They found that they had retirees. They're in a medical desert. They didn't have access to primary care. And like, we've got extra capacity in our primary care. So 300 retirees are accessing their clinics. They had no obligation to do that. But that's the type of thing that happens. Again, there's current employees who are eventually going to be retirees. Like, that's pretty neat to have happen. And they're making, basically they're opening their books and blueprint to other employers in that area who have similar challenges to what they had.
Cool. Dave, thank you so much. How can someone get in touch with you?
Yeah, so healthrosetta.org is our website, and I'm just Dave at healthrosetta.org. I'm not the Sopranos producer. There's a David Chase out there. I'm not that guy.
Not that guy.
But I do better than him on Google. So you Google me, Dave Chase. I'm on LinkedIn. I love to hear CEOs go, what? I can actually do something here? And, there are really good people who've just been told they can't do anything about it and just suck it up. And when they learn that there's another option, it's really great to help them out.
Yeah, they just sparkle. They just radiate. It's like, yes.
Yep, absolutely. And in this day and age, when we have pretty full employment and you want to have the best workforce possible, it's great for the bottom line too.
Yeah. Dave, thank you so much. This has been amazing. This has been great. Thank you so much.
Absolutely. My pleasure. Thank you for having me on.
You bet.